judges. My name is Letisha Levy. I have been a consumer partner in research, serving on numerous working groups, advisory groups, steering committees, and as part of the investigator team to ensure consumer voices are not only heard, but valued at each step of the research phase. Today, I will share a glimpse of the positive impact my partnerships have had within a hospital and health service. At Gold Coast Hospital and Health Service, I'm the chair of the Consumer Advisory Group. I also sit on the Gold Coast Health Board, Research Committee, and other clinical governance committees, such as Partnering with Consumers, Disability Committee, and Diversity and Inclusion. I've also been a part of the investigator team as an associate investigator and a co-chief investigator. I've been scoring research grant applications for 4 years from a consumer lens, giving weight to projects that genuinely incorporate consumer collaboration and meaningful partnerships. It was identified by consumers and researchers that further investigation is required to ascertain whether and how consumers and researchers wish to engage in meaningful collaboration. At Gold Coast Health Board, through collaboration with the Consumer Advisory Group, has demonstrated its commitment to meaningful consumer engagement in research by endorsing a co-designed framework for consumer engagement in research at Gold Coast Health. I was a consumer participant on this project, exploring barriers and solutions to consumer involvement in health service research. The project findings were finalised in 2024. They've been approved by the board and the manuscript is yet to be published. As the chair of the Consumer Advisory Group, I contributed to the consumer engagement strategy for 2024 to 2027. One of the 4 priority areas identified in this strategy is consumer engagement in research. This is a significant milestone and is aimed at fostering meaningful partnerships between consumers and researchers. It emphasises co-design, collaboration, and the integration of lived experiences to drive improvements in health services and research outcomes. My influence and impact in health and medical research, whether that be in committees, working groups, part of the research investigator team, or scoring grant application rounds, is in alignment with my values and that of the hospital health service, which is shared decision-making, ensuring that consumer voices are central to shaping research priorities and solutions, and that healthcare innovations are both patient-centred and impactful. Thank you for considering my application.